Hello, I'm Fred Guthrie. I'm the architect and product manager for EdFX Population Payment Management and our recent released Episodes of Care module. We created this software product to respond to the new requirements that hospitals have for managing the mandated orthopedic bundles from CMS under the Comprehensive Care for Joint Replacement Program, or CJR. New alternative payment programs like CJR create a number of IT challenges that can't be easily addressed by most hospital billing systems. The complexity and scope of the hospital's responsibility for the entire 90-day episode for a knee or hip replacement procedure requires a different type of technology. The hospital billing systems and electronic health record systems are not built to track the services delivered by the providers who take care of the patients during the post-acute phase after discharge. To succeed under CJR, hospitals need to start by understanding the historical cost and quality performance for all their Medicare hip and knee replacements. Hospitals use the Episodes of Care module to import historical payment data from CMS and perform a detailed analysis of cost drivers both within and outside the hospital with post-acute providers. This view shows the data analysis capabilities. Here, a hospital can look at the total and average cost of all previous episodes from the reference CMS data and project future episode cost under CJR, as well as perform important what-if analysis by modeling different assumptions. The software makes it very easy to establish exactly what savings are possible by changing primary discharge patterns from SNF to home with home health support services, for instance. You can also use the product to select the best post-acute community partners to include in your preferred network and develop patient-centric program offerings for the CJR model. With the Episodes of Care module overview dashboards, hospital managers in charge of their CJR program get a consolidated view of how all CJR episode costs are trending and how they compare to the target episode price set by CMS. The graphs on the bottom of the screen show how many episodes are producing savings, which providers are generating these savings, and those whose services run over budget. It's critical to keep the financial status of episodes current with the near real-time data updates that the product supports. The system is designed to ingest claims and eventually clinical data from both within the hospital, from orthopedic practices and post-acute providers on a routine basis. We also built in workflow tools to help program managers perform their work. On this screen, you see a task list on the shaded tab to the right, where the user is prompted to review, approve, and take action on items pending, like investigating and resolving an incomplete episode. Our customers gain efficiency from these lists and other workflow tools for managing each patient's cost and quality results. Use the Episodes of Care management module to evaluate historical and current performance of post-acute providers and determine the average cost per episode of each post-acute provider and setting mix. Modeling and understanding the best care path for each type of patient and procedure is critical for optimizing cost, quality, and patient satisfaction under CJR. The partnerships that hospitals create with orthopedic surgeons, community and post-acute providers who take care of knee and hip replacement patients under CJR are critical to the success of the 5-year program. Under CJR, hospitals can gain share with partnering providers who collaborate to provide quality CJR care and reduce costs. The Episodes of Care module supports identifying and targeting those preferred providers and monitoring your gain and risk-sharing agreements as permitted by CMS. Partnerships require transparency and frequent reporting on cost and quality performance. Hospitals need to share performance results with providers not just at the end of the quarter or year, but as frequently as the volume of their cases require. The Episodes of Care module makes it easy to share the current and projected performance under a given patient episode, or all episodes, and also for improving the specific outcomes for a given patient. What you see here is a dashboard for a specific post-acute provider who is seeing CJR-eligible patients. Hospitals can drill down into the performance of all of these facilities and outpatient services provided to each CJR patient to isolate the performance patterns of any given partner and share those results to reinforce the care protocols and cost and quality targets established for the CJR program. Let's say I'm a hospital CJR program analyst and I'm preparing for a management meeting to discuss the overall program performance that includes a detailed review of any outlier cases. I would navigate to this episode list view of my CJR program data and select the particular patient episodes that we want to examine more closely. I select the episodes you see highlighted here on this screen and drill down into its details. Hospitals also need to audit and validate CMS facility and region data and be prepared for the final CMS report after the close of a CJR program year. It's very important that hospitals are prepared to respond quickly to any discrepancies or potential errors that they may find in the final CMS report, as this report is the basis of all gain or loss sharing with CMS. The hospital's risk of loss in these episodes begin in 2017. Hospitals can use the Episodes of Care module to ingest CMS data to identify and prioritize differences in result scenarios, develop a final view of utilization and quality results in advance of the CMS report. Thank you for exploring the capabilities of the EdFX Episodes of Care module, and to learn more, go to www.edfx.com.